everybody. Let's call to order the January 24th meeting of the Early Learning Council. And Alyssa, will you please call the roll?
Sue Miller.
Here.
Patrick Allen. Here. Martha Brooks, do we still have you on the phone?
Yes, you do, for about 15 minutes, and then I'll be gone for 45 and then back.
Okay. Janalda Dodson, do we still have you?
Yes, present.
Thank you. Colt Gill is excused. Holly Marr is excused. Farabors Paksaresh is excused. Eva Ripito, do we have you yet? Okay. Shauna Rodriguez? Here. Donna Schnitker, do we have you on the phone?
Yes, I'm here.
Great, thank you. Terry Tallhofer?
Here.
Kali Thorne-Ladd, do we have you on the phone?
Yes, I'm here.
Thanks, Kali. Bobby Weber?
Present.
Miriam Calderon?
Present.
And then for our advisors, we have Kate Wilcox.
Here.
And then Bill Bainey for DHS. Here. Great, and then Kara Williams for ODE.
Here.
Perfect.
All right. Thanks, Alyssa. Well, welcome, everybody. Obviously, our first meeting of the new year. Hope everybody had a nice break, those who got breaks. And obviously, we are just at the beginning of a very exciting, ambitious legislative session. So I'm guessing we will be crossing paths more frequently than usual in Salem and in the Capitol. But we'll be talking about that more in just a few minutes. The only chair's report I would offer, and you all have seen it, but our strategic plan got formalized, professionalized. It's really quite an impressive document now. I'm dying to see the printed copy, which I know is coming at least by February 5th, if not earlier.
If you stick around, Sue, I'm going to pick it up a proof today, so.
Okay.
Yes.
Oh, there's an incentive. To
Yeah.
All right. And we once again have Build to thank for providing a lot of the technical support for turning it into a document that I think will be very readable and interesting for people to see what is the 5-year vision for early learning in the state of Oregon. So congratulations, Miriam, and your staff for getting the content put together.
And Alyssa Chatterjee had put just a tremendous amount of effort into the engagement process and sort of every step of the way. So I think lots of folks that have contributed to this, but Alyssa, thank you. Thank you.
Right.
Can I ask a quick question about it?
Yes.
Is there a role for the council in terms of distribution of it, or at least a high-level summary, so that I brought it up because I'm part of the preschool task force that's at Multnomah County, that we should, be looking at the plan. And it occurs to me we're all sort of in different spots in our community that we can help distribute it, but I don't know if there's already a plan, and I don't want to sort of supersede or overstep any sort of vision you have around distribution. So just wanted to get a sense of that, what you're thinking.
Great question, Kali. And I'll let Alyssa and Miriam answer. I'll just say that I think 2 weeks ago, I went up to Astoria and met with the Northwest Early Learning Hub Governance Council. And we just spent a morning going through the plan and looking at how all of the sectors are working together. They were very excited to see the different symbols, icons that are by the strategies in the plan. That's quite an innovative part of our plan, and certainly is a visual representation of the cross-sector piece. And so I think there is going to be a role for council members to play, whether it's working with hubs or other partners. But maybe one of you wants to respond.
Absolutely, Kali. I think great question, and it's a great tee up to the agenda item we have around kind of next steps for the strategic plan, where we really want to talk about dissemination and some intentionality around that. I think as Sue's saying, both leveraging the hubs as well as individual council members to be able to talk about the plan and disseminate it. So we can come back to that on the agenda, I think, and continue the discussion. But I think at the same time, time, it's also not a secret right now. So there will be, opportunities. I know in session, I gave a presentation yesterday and talked about the plan. So even as we're working towards, the legislative breakfast, which is part of dissemination, I think if you have opportunities like what you're referencing, Khalid, to talk about the plan and use it, we should all feel empowered to do that. Sue's already had a meeting in a community. But we want to kind of work on that, I think, is a key next step, and figure out what support council members need, what support hubs need, and individual agency partners.
Yeah.
Okay, thank you.
Alyssa, do you want to know where we've shared it or where we plan to share it? Because unlike Kali, I've already jumped on it. And I shared it with the Coalition of Local Health Officials last week, and they were very excited about it. I keep getting comments, it's beautiful. That's the comment that,
Yeah.
the way it flows, the way it looks. And then we introduced it at our local hub last week, and we're going to have a bigger discussion at our next governance board. And then I've offered to go to the 4 community advisory councils in my region for the CCOs and share it as well, since I regularly attend 3 of those. So might as well go to Wheeler County too,
Sure, while you're on the road.
while I'm on the road.
It's great that it's beautiful. I'd rather hear that it's actionable.
I just think the first impression that it's eye-catching means that people are going to open it up and look at it. Our hub director actually laminated the executive summary for all the governance board members and said, put this where you can look at it all the time, because this is what we're going to do.
That's fantastic.
So I thought that was
Yeah, that was
great.
fantastic. Thank you for sharing that, Terry. I think it would be great to be able to capture where you're using it and talking about it. And I think, to hear the local, it's been local public health officials are getting it, I think is terrific. So I think using probably council meetings or even just, dropping Alyssa an email, as well as kind of feedback and ideas that you're getting from that would be just great to capture.
Okay, thank you.
Okay, so New Year's off to an exciting start. Let's go to the consent calendar. We, as you know, have 2 committee reports, Best Beginnings and Measuring Success. And for each of those committees, there are recommendations for adding members. And will you just tee up for a minute, Alyssa, before we go there, about what's it mean to add members at this point when we're in a transition period?
Sure. So these are sort of specific circumstances, and that's why we're moving forward with this. And I know Martha can speak to this, but because Best Beginnings is also the HFO Advisory Committee, there's additional membership requirements that the committee was not currently meeting. So we want to make sure we're in compliance there. For Measuring Success, this is partly in response to Khalil's suggestion that we engage the African American Black Student Success Committee. And so before we got much further down with the dashboard, we wanted to make sure that we try to recruit and make sure we have as many perspectives as possible in the creation of that dashboard. So very specific reasons for this, which is why we haven't revisited membership for the other committees at this point.
Okay, thank you
Yeah.
for sort of that background and overview. So Martha.
Chair Miller?
Yes, you're on the phone, so would you like to make any comments about your committee report and then make a motion for appointment to your committee?
Yes, thank you very much, Chair Miller. There are 2 people right now who are on your report that is in front of you. One is from a small, healthy families, and one is from the large. We do not have a response yet out of the medium one, so that one will come later. But they have both accepted if they are approved today and will serve in a temporary basis while we reconfigure our committees. So I move that we accept the 2 HFO program managers that have been submitted
All right.
for membership on Best Beginnings.
Great, thank you, Martha. Is there a second for that?
I'll second it.
Thanks, Terry. And as you know, council, from our packet, the representative from the large site would be Beth Dasher with Washington County, and the small site, Julie Rogers from Eastern Oregon. So is there any further discussion about the appointments to Best Beginnings? If not, those in favor, please say aye.
Aye.
Opposed?
Aye.
Oh, delayed ayes. Sorry. I always forget about
Yeah.
that. Thank you.
Technology.
Yes, it's unanimous. Martha, any other comments you'd like to make about your committee report?
No, not really. I mean, we did have a presentation out of the legislature on Family First, which is a piece of federal legislation. I'll just say that we had a very robust conversation about it, and we're waiting for some direction as far as what else we need to do to move forward the prenatal to age 3. So we're waiting.
Okay, sounds good. Thank you, Martha. So let's then look at the Measuring Success Committee report. And as we all know, Holly is on maternity leave. So Bobby is also on Measuring Success, and I believe is going to fill in for us for
I
a
am.
few months.
Yes.
Thank you. So comments and then discussion or nomination of your additional member. Thank you.
We're making very steady progress, and I think the most exciting part to me is how cross-agency the dashboard is. It's, so the last meeting, we heard a lot from early interventions data, capacity, and what data they can provide into the dashboard, and what goes behind it, where the numbers come from, and it was really interesting. And next month, we're going to kind of same kind of population, but expand out and look at the children who get a positive referral but don't go into EI. And the group that Colleen Ruland is heading up is getting pretty darn close to metrics, and so we'll get a sense of how, of what we can do with that. But every meeting, we're a bit closer to having data points that are meaningful and that are, whose numbers will be actually provided by agencies as a part of their ongoing work, which will make our dashboard a doable, effective tool, and hopefully used by all the agencies. That's one of the things that we are going to be looking at is how much do the other agencies think that this will help them? So it's not just something we're creating in a vacuum, which we're clearly not doing that, but that this one more step, will they use it? And what do we need to do to be sure that this is really usable to not just DLD, but to all of our, anyway.
Great.
And then
That's
the
exciting.
nomination, Alyssa has probably said everything I know to think. We're excited to bring Kendra on, and she's agreed to do it. And she will bring a much more deeper understanding of how these measures look for African-American populations.
Awesome. So you're moving.
I move that we approve Kendra's membership in the Measuring Success Committee.
All right, thank you. Is there a second for that?
I second.
Second, it's Cully.
All right, Kali, thank you. And thanks for the recommendation, Kali. Great. Great.
Yeah, that's all the work. This is great.
All right, discussion. Those in favor say aye.
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 Any opposed? Pausing for the phone people. All right, motion carries. So welcome Kendra Hughes, and we're excited to get additional input on measuring success. Any questions from council members of Bobby? Once again, that cross-sector piece is obviously just
Very strong.
strong and key. And we appreciate all of the early learning partners being invested in that. Very exciting. All right, that ends the committee reports and the chair's report. So let's go to our director's report. Miriam.
Hi, Sue. Thank you. So you have in tab 2, you have a sort of written copy of the director's report, so no slides. Just a few kind of items to go over. One, the first is preschool development grants, birth to 5. I think I have emailed you all about this, but we are absolutely thrilled that we did receive $4.2 million in federal funding through this grant for the remainder of the calendar year to implement our plan. And I think as I've shared and talked with all of you, this is really a plan. We wrote this plan really thinking with Raise Up Oregon in mind, and how, really, these are resources, I think, to allow us to begin to implement some of the strategies in this plan, so it's really exciting. We had originally written to $6 million, and we only received 4.2. The Administration for Children and Families decided to do a sort of all of the selected states, just fund all of them at 71% of their requested amounts, sort of across the board. So that is the reason for the reduction. The fact that we did receive funds in this round and Oregon was selected does make us eligible for future grant cycles. So any state that wasn't awarded in this round or territory, of which there were not many, isn't eligible to apply. The Administration for Children and Families has already put out a forecast for the next round in October. So this is sort of my silver lining on this, and not getting our full $6 million is, I think, one of the big factors is going to be states that maybe haven't spent the resources that they received will have some probably issues in maybe round 2. So maybe it's good that we were conservative and and then in our sort of original ask. So anyway, that's my silver lining. We've started the exercise of cutting $1.7 million from the grant, which was not fun. I skipped that meeting, thank my colleagues, were able to do that discussion, but, and so we're really in the phase now of negotiating with ACF around our sort of revised scope and budget. I think we were looking for where we had sort of opportunities to, some of the criteria I know that my colleague shared back with me was, where's work that we could move probably, maybe not to the extent we had originally envisioned with resources, but stuff we could still get done or at least started with some of the resources that we had. And then also to my point about year 2 funding, what are some of the activities that were proposed kind of later in the year that, would just maybe end up being kind of a challenge for positioning us for being eligible or being in a good place to secure year 2 funding. So the grant is pretty prescriptive on when you can engage in certain activities and the sequencing. And so we were looking at some of those kind of end of the year things and trying to reduce scope there. So that was sort of our strategy. Otherwise, when you do write a grant and you are kind of conservative and things like that, it does become hard to cut. And then finally, the ACF was pretty also clear that the first 2 activities, doing a statewide needs assessment and strategic plan, were 2 things that absolutely could not be, you still had to do, so those were not options in terms of, taking off the table. We, as you know, we have a great strategic plan, so we did not plan to spend a lot of resources on that. We instead will be thinking about the resources through this grant that will support us in implementation. But we, from a sequencing perspective, we do have to also concurrently be working on our statewide needs assessment. And again, with that, our approach was to, in developing the application, was to think, where did our engagement process that we undertook over this year in terms of developing Rays of Oregon, how could that be enhanced with additional information? I think one thing that rose up to the top was just data and sort of our capacity and ability to kind of collect data, not just like look at some of the data, love the data that we have. And so I think one of the things that is mentioned specifically in the director's report is doing a facilities assessment as something that's pretty resource intensive. The other area where additional resources would be helpful is to start to think about unduplicated counts of children and starting to get data, really being able to understand where to help really communities as well as us in the state level really understand, okay, where are there gaps of children really that are not getting served at all, and sort of some of that kind of more intensive sort of risk and reach data and so that's, I think, some of the highlights of sort of the needs assessment. So again, that information will be coming back. We're in the process of really kind of getting that set up, but really I think, the direction that we're heading with the statewide needs assessment. I wanted to just also mention, we have resources in the grant to be able to get a jumpstart on training for Family Connects for communities and local public health. So we'll be working with Pat and Kate as soon as we finalize the details with ACF and being able to start that collaboration with all of you. There are also a number of areas where we're really excited about being able to work with hubs around their piloting of coordinated enrollment, doing community plans. So we'll be getting kind of project teams together soon. I think we just sort of finalizing these details and sort of moving on that. One of the other activities that we were still able to retain. Again, it wasn't budget intensive, but I think will be really interesting work to be able to bring back to the council, is doing some roundtables across the state around blending and braiding funding. So you, Kara, I think, and Bill, that will be really interesting for us to understand more from a community perspective than the folks that are putting these multiple funding streams together. What are they feeling like are barriers or challenges? What kinds of support should we be providing? What could we be learning in terms of people who have figured it out, and how could we be sharing that information with across the state. And I think this sort of goes, the grant, as I'm talking, just want to make sure to remind everybody, the grant was really kind of early care and education focused, right? So it was a lot of sort of, child care, preschool, kind of supporting the workforce, families, knowledge and supports, and being able to, get information about ECE as well as information about how to support their children's learning and development. So that was sort of the framework we were starting from. So I'll stop there. Any questions on that? Or
That's great.
Harry?
So
Yeah.
Madam Chair, I have a question. Is ACF thinking of the preschool development more as an initiative, with this being an initial round of funding? Are they connecting CCDF and Head Start funding in their thinking? What are the feds envisioning?
Great question. As you know, it was authorized in ESSA. And then but even though it was authorized in sort of federal education law, it was ACF is administrating it, and I think there is some collaboration with, Federal Department of Ed and Health and Human Services. But what it really started out, I think, in their approach right now is to think about infrastructure and capacity in states to be able to bring all of those different kind of funding streams together. When I say sort of kind of ECE focused, kind of early care and education, supporting the workforce, supporting families, having a plan and a vision in the state about how to better coordinate and align those funding streams. And then I think in the second round, we'll probably see more about you know, more opportunities maybe to think about using the resources for direct services, maybe. I'm gonna also ask Shauna, she's been in some of gotten some information, I'm sure, from Head Start collaboration directors sort of about the vision, but remember the previous preschool development grant opportunity was funding slots, and Oregon applied and was not selected, which may have really actually been a really good thing, because then those states that did fund slots with that money were not refunded. They shifted to this sort of new direction, which is this year, what we know is really kind of infrastructure capacity, have your strategic vision for ECE in your state.
One-year funding does not really make a lot of policy sense. And so I'm trying to
Yeah.
understand the big vision
Yeah,
to see
Yeah.
how we're going to work most effectively with some kind of, seems to me problematic national thinking,
yeah,
these one-year
right.
pieces.
Well, but I do think.
You can't
we were
even build an
able to-
infrastructure in 1 year.
No, of course not. But we were able to, I think, kind of look at the application and find ways in which it could be, you know, where
Oh, right.
capacity was helpful. But again, it was very much, you know, it was, I think we also, a lot of our ideas were influenced and impacted by, but we have to be able to do it in a year. You know, so for example, data system for ECE, and it's a huge need within the division, right? To be able to sort of really get child and family level data in a system where we can analyze it and use it. But we knew we couldn't do that in a year. You know, so you're right. I think that is sort of a challenge around this. But what I would say we have to do is look at what the next opportunity looks like and evaluate whether, you know, that makes sense for Oregon or not. But you have any
Shauna, do you
ideas?
want
Yeah.
to add to
Yeah,
this?
sure. So I think, you know, Miriam did an excellent job of covering all the pieces. I think that the intention with the legislation in ESSA was for it to be a 5-year project, but it was not funded in the beginning, so we're a couple years behind. So consequently, with the intention is for it to be direct service slots, as far as it's understood right now, and that can obviously morph and change, with some of that money being set back for infrastructure. So the reason that only recipients in this round can be part of the future rounds is because they want you to have a set assessment and a set plan, so then you know that you need a data system, and then you can add that into the next year's application and doing that piece. But I think the big risk, I mean, Miriam really captured it, the states that got it in the first round are not eligible for this. And they keep going back and forth about whether they'll even be eligible for the next round of it. So they got one shot and then lost all those services. And so I think that trying to be cautious and cognitive of that as we look at it, and because it didn't get funded, and it is funded now, but we don't even know if that next round is going to be funded. So we got to use what we got when we get it. So I think they've done an amazing job of finding the pieces that we can really build at and look at in more depth that can be handled in a short period of time.
So basically, the national vision has some flaws.
Basically, yes. And they did, I mean, they've hinted towards the fact that carryover balances are typically offered in grants if certain things haven't been completed. Like they've offered those things, but the money ends on the end of December. So they're trying to work within the constraints they have to make it be successful.
I just wanted-
But you may have just coined the closest I've ever heard to a universal government motto. You gotta use what you got when you get it.
Yep. Yep.
Is that above your desk?
Yeah.
That should be-
I was going to say that the federal policy process is flawed.
Understatement, to be sure.
Great.
Okay.
Do you wanna-
Let me just interrupt the director's report for a minute, and so, because of our agenda, saying that public testimony would be at 11:25. So I just want to see if anybody has signed up, Alyssa, or if anybody is here who would, thank you, like to speak. All right. We have Jamie Edwards, who's with Happy Valley Montessori. So, Jamie, hi. If you would like to come forward and sit up there, so you've got a microphone and we can hear you.
I just bring my
You certainly definitely. Thank you for being here today.
Happy to be here.
And,
Taking some time away from the children to be with adults.
oh, well, there's,
Serving the same purpose.
Yes.
yeah, we sometimes act like children.
So my main, I don't know if this is really the appropriate time, but obviously with the new rules and regulations that are happening for early childcare are affecting our communities in a lot of ways in a really wonderful way. I mean, as far as the Oregon Montessori community, we can say that a lot of some of these new proposals are wonderful, such as limiting screen time, obviously testing the lead for waters, making sure that the criminal background registries, that these are, that qualified people are taking care of the children. Some of our biggest concerns have been with the tables for the age groups and ratios. And I speak obviously on behalf of the Montessori method because that's what I practice. But I also, in attending some of these meetings, recognize that there's other programs and in-house programs that have been around for a long time that also have age diversity and as well as multiple teachers and in some cases even a larger number of children than you would think for this age group to be beneficial. But what happens in some of these methods, alternative methods, is that you are protecting the child community itself, that a 6-year-old can help a 2.5-year-old learn the same things and emulate some of the stuff while that 5 or 6-year-old is gaining that self-esteem and confidence in working with younger children. So, I mean, just in a nutshell, thank you for postponing some of this stuff and reevaluating it and hearing our comments. We feel heard now. We did meet with our Oregon Montessori Association, met with Peter Bloom a couple weeks ago, and I know he took some notes and was passing on to some of you, so we appreciate that. I think that's about all I'd like to share today.
Thank you, Jamie.
Thank you, Jamie.
Yeah, we appreciate you coming and representing the Montessori Association. Are there any questions from council members?
I would love to hear, and if you feel just what some of the kind of key highlights were, some of the feedback that was provided from the association meeting. Was it mainly the tables? Was that, yeah?
As far as the Montessori
Okay.
community, yeah, I think that was the biggest one. I know for some of the programs who have the infancy, some of the ways that we've done sleep, but the limitations, and obviously this is probably coming down from statistics and things that have happened in other childcare facilities that we're trying to make sure nothing's in there and you do it a certain way so that that the children are safe. But it definitely, I know that was a small part, but I don't work with the infants and whatnot. So as far as when we took a collaboration of people who have been doing this for over 40 years that have had, I guess it's been known as like the exception just because Montessori's been around, since 1907, if you will, and has a pretty long and successful standing here in the state of Oregon, that it seemed to be more about those ratios. Just because in a Montessori classroom, no matter what, you never have just one teacher. It is individualized curriculum. So what that looks like, and that you would never also have the same age of children. That there is that diversity, and that in combination, that's really how it works. So I really feel like that was the biggest concern, even from in-house programs all the way up to some of the larger schools where they have the toddler all the way through junior high and maintaining those kind of numbers. But obviously, we're talking about this infancy till about 6 years of age. So that was the most important one.
Thank you.
Thank you, and thank you for working with our staff. That really helps a lot to try to figure out at a staff operational level, how to accept and incorporate your input where that's possible.
Well, we're still in the classroom, so I'm sure that helps. And we encourage any of you, I mean, we're a very open community, so come and visit our schools, come and see what it looks like, you're more than welcome.
Great. Thank you, Jamie.
Thank you for your
Thanks,
time.
Jamie.
Anyone else wanting to speak? Okay, if not, we will close the public testimony and go back to our director.
Great, thanks. So the next update is our WIN grant, which was submitted, and I'm actually going to ask Alyssa, who really helped make this possible through a collaboration with ODE, to share a little bit about where we are right now in the process.
Yeah, so it's written in your report, but basically, we were informed about the EPA offering, we're calling it the WIN grant, the Water Infrastructure Improvements for the Nation Act, authorizes this. And so it's targeting both childcare providers as well as school districts to help with lead testing, not necessarily mitigation. And so we've been working with the Department of Education to submit a joint letter of intent, given that, from what we understand, we cannot use the funds to reimburse testing that's happened. We wanted to make sure that jointly we'd be able to expend all funds that we may be given. We are working with the EPA, with our contact at the EPA, to be a little bit inventive with what testing means. And so beyond just covering the cost of like the lab kits, but actually hoping to have some funding set aside to provide technical assistance and supports to providers, particularly our providers who speak a primary language other than English, as we know that became an issue as you were collecting lead testing results. So that's one of the ideas we had, since we can't help offset the cost of mitigation with providing additional supports in that testing phase. So we're supposed to hear back by February 22nd. Obviously, that timeline will likely be shifting, but we haven't received any updates on when that might be. So we'll be coming back to the council as we learn more. But as of right now, the letter of intent was really all we needed to do, kind of outlining broadly what our thinking behind that process was. So if anyone wants to see a copy of that, or if you have any questions, just let me know.
Awesome. Great. Any support we can get for that very important program would be wonderful. So thanks for finding it.
Yeah, we're excited.
Any questions from council members or anyone on the phone? All right, thank you.
Yeah.
Vanessa. You wear a lot of hats.
Thanks,
We've noticed
Alyssa.
that.
Thank you. Okay, so moving on to hiring updates. Let's see, I'm excited that Melanie Maceros is here. Hi. Second day. I don't know if do you want to just, since you're here, talk a little bit about, thanks. Melanie is our new communications director, so public information officer. She's coming from Port of Portland and has a long track record in, a great, excellent track record in state service. I don't know, Pat, if you and Melanie.
We worked together at DCBS for more than a year.
Yep. So we are just thrilled to have Melanie on the team. So I don't know, anything you want to share about your background or?
I'm just really excited to help with this area. It's new to me. I will say the education world will be new to me, but I have a lot of experience with communications and I'm excited to put some of those skills to work for the division. I think there's a lot of work that's happening here that can be communicated to all the different stakeholders and the public in a way that will help people move forward and make some progress.
So we are excited. She's jumping right in and we said, help us get out some information about Raise Up Oregon. So, yes.
So Melanie, a question for you. I see in the write-up that you're a former news reporter.
I am.
What's that referring to?
Well, I used to be a radio reporter. I worked at both KEX and KXL Radio and did also a stint at KOMO in Seattle. And I covered some pretty interesting things. I did cover the Virginia Tech shootings for a week. They sent me to do that in my career. I covered some of the presidential visits to Portland and I would say a lot of day-to-day coverage of government and just topical issues. So I have a lot of experience working with reporters and used to be one. So I think coming from that perspective, it's always helpful to understand what they need and put forth information to them in a way that will be useful.
I would guess having that insight will be very, very valuable.
Can I ask a quick question? This is Kali on the phone.
Sure, Kali.
So with the upcoming legislative session and all of the sort of important communications that go out or will need to go out on the importance of early childhood, will this position, if the board wanted to make any statements, would they work with the board or the council as well, or no? Is it just for things coming? We've talked about in the past, like the council being engaged more in whether it's an op-ed or something to support early childhood. And I'm just wondering if the position covers that or if it's just only focused on the ELD.
Yeah.
Does that make sense?
Yeah, no, that's a great question. No, absolutely. I think Melanie is going to be very much engaged in helping our communications and responding, I think, to all the interest in our work. And I think Raise Up Oregon, the governor's agenda and priorities for session around early childhood. And I think and that extends to, amplifying, I think, the voice of the council as well. So absolutely.
Great, thanks.
Right. And this probably goes without saying, to just try to coordinate where the council can weigh in and support the communication efforts, connecting with Miriam.
Yeah. So Sue's testifying on Monday. So we're more on that soon. So absolutely.
Fun,
Yeah.
come on down.
Yeah.
All
right.
right, welcome. We're excited to work with you, Melanie.
So yeah, you will be hearing, I'm sure, and seeing Melanie more. So.
Awesome.
Great. I'm also really excited to announce, thanks, Melanie, that Joan Blau has accepted the position of Community System Director at the Early Learning Division. This is a team that's bringing together our quality improvement and professional development team who provide support to our child care resource and referral partners throughout the state, as well as oversee SPARK, our quality rating and improvement system, with our hub team, as well as our P3 team and our VROOM initiative around parenting education. So that's a team that's coming together. It's a new team where we're kind of consolidating a couple of different teams within the early learning division, really, I think, around where we have kind of regional strategies and where we're really working really closely with hubs around administration and implementation of some key programs and communities. Joan, I'm sure if you had a chance to read her bio, has a lot of experience, I think, thinking around the design of community systems in our field. And, as I think as many of you know, Oregon is one of not that many states that has sort of made an investment in sort of capacity and infrastructure at a regional or community level around cross-sector systems, and gets recognized so a lot because of the investment in hubs. And I think the vision that they would be so closely connected with CCOs. And so my point in this is that when you're thinking about a group of, I think, professionals in early learning, there are not many, right, that have a lot of experience with community systems, because it's just not a place where the field has evolved in a lot of other states. And so I think beyond, we were really lucky to have somebody applying that has a background, I think, in this very comprehensively. So as you'll see from Joan's resume, she helped develop Michigan's sort of early childhood community systems effort, which is pretty mature at this point. They call them Great Start Collaboratives, and they have a parent coalition sort of component to it. And I think as you get to know Joan, you're going to discover she's very passionate about in particular around meaningful and authentic family voice in systems design. I think it's going to bring a lot of really good ideas, as that has been, again, been a huge component of Michigan's sort of early childhood community systems effort. She also helped with the implementation and design of the state's quality rating and improvement system. Joan did some consulting with us this year through Build, so we got to know her and she got to know the state a little bit. So I think that's also really exciting. And I've known Joan for years just because of her work in Michigan. So she will be starting on February 1st and is starting in time. February 4th, and is starting just in time to be able to be at the Hub Collaborative. So.
Timing is everything.
Yay. Okay, so any questions about Joan and that new team? Great. So I also want to mention that we have a new manager, coordinator for our Preschool Promise program, Dana Young. Is she? No, not here. Okay. She is, we're just thrilled in having Dana join the team. She was the Preschool Promise coordinator for Marion and Polk Early Learning Hub.
Yes, she was.
Yes, so
She's really good.
hug Lisa Harnish if you see her.
I'm buying her lunch next week.
Okay, thank you. So sorry to let Dana go, but we're just thrilled. She has very just phenomenal experience in implementation of Preschool Promise. Marion Polk is, just our largest Preschool Promise grant, and just a terrific partner. And so, Dana's just bringing a lot of passion from, what she's been able to do in Marion and Polk, and now think about, how to help and support the effort across the state, just in time as we hopefully think about real opportunities for Preschool Promise expansion that the governor is prioritizing. So that is really exciting. And then last but not least, Joanna Shreve has joined the Early Learning Division as a research associate, and she is really going to be connected to the Baby Promise Initiative. And we're excited because this is really adding some capacity within the ELD around data and research. And in particular, we think that's going to be key as we understand and we learn from the pilot of Baby Promise, and we think about how that's going to inform scale. So she's going to be really connected to some of that work. I will close director's report by saying we are recruiting for 2 really important positions in the ELD that I hope you'll all help and sort of spread the word to your networks. One is a deputy director for the Early Learning Division. And we're really looking for somebody that it can really be internally focused and help with sort of the day-to-day supporting kind of program and operations within ELD. And we're also recruiting for a field operations director in the Office of Child Care. So this would be supporting regional managers and the work of our licensing specialists. So I can send those links out to all of you, and would appreciate you helping spread the word.
Wow,
Yeah.
exciting times. Yes,
No, we
Bobby.
do have
I have
Eva
a
on the phone.
question.
We've had Eva join the call as well. So
Okay, thank you.
Thanks, Melissa. Yes.
I assume this means some shifting around of existing. So like Johanna will join Tom and just expand the research focus?
Yeah, it will be a colleague, yeah.
Okay,
with Tom.
and then does she pronounce her name Dana?
Dana, yes.
Does Dana, what happens with Gwen? I mean, is that all
yeah.
being reshaped?
Absolutely.
I'm assuming when we add new, we're doing something.
Yeah,
To
absolutely.
what exists.
Gwen, and I think I mentioned this at probably our last meeting, Gwen has accepted the position of Early Learning Programs Manager.
Right.
So what we've done is now our OPK specialists, program specialists, as well as Dana, our Preschool Promise, are all part of a team that Gwen is leading. And our new Baby Promise coordinator as well, that was one of the positions that we got in e-board, will also be on that team that Gwen is leading.
Okay, so we now have a unit that is Preschool Promise, OPK and Baby Promise when, as it evolves.
Yep.
And, okay, and with Gwen heading.
Under Gwen.
Under Gwen and Dana doing preschool promise, and who kind of heads up OPK? Michael?
Michael does OPK, and then we have Lindsay, and Lindsay does some support for OPK, but also relief nurseries.
Oh, so are relief nurseries in this?
Yeah, they're in there too.
They're in that
Yeah.
also?
Yes.
Thank you.
Sure.
As this sort of evolves, it might be helpful at some point in the next few months to send out an org chart.
Yep,
to
can
the
definitely do
council.
that.
My thought.
Yep, so everybody can check who's where, or moving where,
Yep.
or whatever. So good questions, Bobby.
But yes, the team is growing, and we're excited.
Yeah, we've been
Yes.
talking about lack of
Yes.
capacity for so long. It's really quite exciting
Yeah.
to see capacity building, so nice going, Madam
Thank you,
Director.
thank you.
Any questions of Miriam on her?
The two positions you noted, are they open recruitments right now?
Yes, they are open recruitments, yeah. So I will send those out today.
Yeah, I think they go for another week, right?
Yeah.
February something.
Has the baby promise coordinator position been filled, or is that still open?
It's, I think, I know we were recruiting, I don't know if it's closed yet. Not sure, I don't know, Sarah, it's closed? Okay, it's closed. Yes, thanks.
All right, thank you. So we've had our
This
public.
is Eva.
Oh, hi, Eva.
Hi. Hi. Sorry I had to join so late. But I just did want to flag something. I don't think there are answers right now, but childcare providers are already hearing rumors about shutdown impacts on childcare subsidies, like starting in March. So I got asked about it today. So I just wanted to flag, I don't expect you to have an answer or have a plan right now, because hopefully it'll end quickly. But yeah, I think we should probably think about what impacts there are and how we get our legislators and governor on board for maybe some quick remedies.
I should probably know this, but what agency do childcare subsidies come from?
Administration for Children and Families,
Which is part of,
HHS.
but the HHS budget?
I'm sorry, I can't hear what
They
you
are.
guys are
Can you
saying.
guys speak up so
Yeah,
people can hear?
sorry,
So
yeah.
if the HHS budget is fully funded, maybe the right thing to do is fairly quickly, if that's not correct information, get correct information out.
Right.
Watch that.
The
Yeah,
the information you're sharing is exactly what I've heard on my calls, that it is fully funded and there is not effect for CCDBG. The effects are on USDA and WIC and other pieces.
And a little bit in TANF,
Yeah.
right? So I'm sure Bill could probably
Right, a
speak
little
to
bit in
that.
time,
Yeah,
but we're okay, we're actually looking at the contingency plan, but looking through March, we're fine.
And
Get
through
to-
March is about the same for WIC as
yeah,
mine.
yeah. So, and TANF is in ACF as well, but I think it's caught up with reauthorization. So there's some complexities with TANF.
So,
Okay, so yeah, I mean, if childcare funding is good, we should probably get that information out. I don't know what official meeting that providers were told this, but it was at a provider meeting. So if everything's okay, we should get that information out, I think, quickly.
Thanks, Eva. Bill, is that something we can follow up on? Okay.
Great, thank you.
okay, thanks, Eva. Okay, so one of you, ELD or?
Yeah, I think we
DHS,
can
both.
work with, yeah, DHS and ELD to.
We'll get a shared message.
Yeah,
Okay,
So that all the providers getting that message.
okay.
okay, great. Thank you. Thanks. We have a rules update, childcare temporary rules timeline. It's a handout, council members. So if you refer to that, and we will invite Dawn and Ann to join us. Welcome. Happy New Year to you guys. So this is, as you see from the agenda, council, it's information only. And Eva, do the people on the phone have access to this?
It is online, or it's on the screen, but I will forward it to you just in case you're not able to view it.
Okay, thanks.
Yeah, I see it on the screen. Thank you.
Great.
Right, well, good morning or afternoon. I guess it's just now turning to afternoon. So as you know, over the last several meetings, we've been bringing forward some temporary rules for adoption. And I want to kind of go through an overview of what those have been, just as a reminder. And then we'll share kind of where we're at in taking those temporary rules and moving them into permanent. And we are so grateful to have Anne with us now to help as well with that capacity around it being rule coordinator and building this team up as well for handling the rules. So as you may remember that you guys have adopted temporary rules around the central background registry for some of the CCDF requirements, expanding the subject individual, safe sleep, the required training, as well as the parent notification for when there's a safe sleep violation. Aid 1 training requirements, lead testing requirements, and then the governor's directive on parent information. And you may remember some of those have been some more technical cleanups and some clarity that was needed as we had done the rulemaking process. So these were really more, a lot of it, the intent never changed on these, but more, it was getting more clarity for our providers. And so some of the timelines that has made this very complicated. And again, another reason I'm very grateful for Anne to help track all of this is that within the central background registry, those temporary rules, you guys approved them September 27th, and they are set to expire March 28th. So this is why we're bringing this forward to you as an update of if approved, that we can move forward with opening up the formal rulemaking process and move these to permanent. Also, you'll remember the subject individuals, and this was really around preschool promise, to be able to do background checks on school districts that may have preschool promise. And so those rules we did October 30th, and they're set to expire April 27th. So this is, again, coming up soon. The safe sleep, this was around the parent notifications, and we did that. Just one more. Oh, thank you. Maybe you should click for me because parent notifications, again, we did that on the September 27th, and those are set to expire March 30th. So we want to be sure that we get through the rulemaking process to move those from temporary to permanent so that they don't expire. And a lot of this, it really aligned the safe sleep with the safe sleep surfaces and the varying terms to make sure that there was real clarity for providers. Additionally, adding in the Aid 1 training requirements. We did this back October 30, and so those are coming up to expire April 27th. And it's some of the changes to the Aid 1 rule that was needing to be clarified for CCDF. And then almost finally, the lead testing requirements. There was a lot of the way that some of the rule construction was. We needed to create some more clarity for providers so that it was very clear. And we did those on November 30th, and those are set to expire May 28th. And then finally, the governor's directive on the parent notifications. There was some misnumbering that happened from the permanent rules, and so there's some technical fixes that you approved on September 27th. And so those rules are going to move forward around the serious and non-serious violations. And so those will be ones that will also be moving forward to permanent. Anything you want to add, Anne?
No, just to make clear, we're trying to open up the public comment legislator notice sort of formal rulemaking process for all of these rules so that hopefully on the March 28th council meeting, we can approve them all at once and have all of our temporary rules permanent.
So will you clarify, I'm not, not sure, is the content of what we put in place as temporary changing based on input from anybody? Or is it just verbatim what we've seen before and is in temporary rule, and we're just going to be confirming that?
Do you want to?
That's right. Yeah, the only changes are typos or updated rule references to the temporary rule. So we're opening up for public comment to make sure that we're getting any input needed, and we'll bring that back. But at this time, there hasn't been any changes. to what's currently showing as rule.
Ms. Rulemaker, Bobby.
Okay, I think, this is similar to yours, but I want to be sure in my own head. We're doing the entire rule revision. And we also have a set of temporary rules, and they're different.
Yeah.
And the one that is still being changed is, and that, for instance, Jamie was referring to, is that total rule realignment that we've been engaged in now 2 years or something like that. And so what, if I'm hearing you say that we're going to bring together the movement of things that aren't changing, but they are only temporary, with this major revision that is moving to closure. And we are going to do them both in March?
No.
No, okay.
So maybe if it's okay, can I give an update of where we are with the big rule revision? Because I think that helps to clarify. So I was actually on a call this morning with some of our federal TAs. So we still are going through all the public input that we received and incorporating those changes. We also have laid out a timeline where we're having some national technical assistance review our rules. We still need to do a full legal review. And so we're not at a space yet to bring those forward.
Right.
And so this is truly just making sure that the temporary rules that you all approved don't expire. So it's just taking what has currently been made temporary and moving them to permanent without addressing any of the other input that we got from the full rule input. We're still processing that.
Do we have a timeline on the full rule, the major revision? Do we think we're 9 months away?
I think where we're at right now is one, we're setting up, again, the national TA, and I think that's going to tell us how, more of our timeline. We're also setting up some peer-to-peer state calls, particularly one with Washington State, because they did a similar full rule alignment. We want to make sure that our implementation and communication strategies and plans are set in place, and so.
And that took 5 years.
And that
in
took.
Washington State. The entire rule alignment process to the point where they're getting now. So just
And how long
to
have
say,
we been
we've been
in
doing
this?
it for
Two.
I'm not saying, we have 3 more years. I'm just like, that it's important.
It's a big, and I think one of the things is that, has been, we've needed to make these changes, but one of the things that we're really wanting to time out with the major rule revision is that not just getting the rules promulgated, but then we really need an input from adoption to when they're effective. We're going to need a big, a period of time to train providers, get all the forms changed, any data system needs, because our rules are trained licensors. So there's so much work that's going to need to be done after promulgation. Other states have reported they've taken a full year to really, once the rules have been adopted, to really begin, that they become effective a year later once all that's done. So we're wanting to do a really good job in utilizing our federal TA to really help and make sure that we've thought through all of that process. And so Michelle Adams, actually from Texas, is our technical assistance person that we're working closely with on this, along with Deb Mathias from Build and others.
Wow.
Yeah, so I think so then to clarify, a lot of, as you remember, a lot of the drivers of these temporary rules was sort of a compliance with CCDF, some different reforms, governor's directive, I think, as Ann and Don lined up. So the idea here is to, I think what Ann and Don are communicating is, from those temporary rules, not much has changed. They're going to be brought before you again to be made permanent, and they will go through a public comment period, which will get, so there's an opportunity for more input into these temporary rules.
And we're wanting to bundle it all because it has been very confusing for providers, licensors, I'm sure yourself as well, as these have come at different times. So doing it all the temp rules as a package, we're hoping will help with clarity and the process.
And do we have are we calling them tax? Without the Bobby's committee, racks?
So because
Do we have
these-
a rack?
Because these permanent rules this time are not changing the intent of the permanent rules that have been adopted in the past, for which the temporary rules made some clarifications or needed renumbering and edits. The work that had been done there.
Permanent, temporary.
Right. And I'm new, so it's been great trying to track down the history of every single one of these. But because the intent hasn't changed and the content really hasn't changed, other than to align and clarify, the work that was done by CCEC as the RAC before, kind of on the fiscal impact and all of those other pieces, kind of stands as serving the purpose of the RAC for this time. So we're not reconvening or anything.
But as we,
Or for the?
Just for
this.
yes.
Okay, and I was really, thank you for that clarification, Anne. And I was really referring to this huge 2 to 5 year.
that is exactly what part of the project plan is. And so incorporating, getting the TA review, legal review, and then we'll be moving into the RAC, doing I can't even think of what it stands for, Rules Advisory Committee. And that will move through that process. So we'll be forming a Rules Advisory Committee to do this work. And I think one of the things that we're teasing out is, do we have 3 Rule Advisory Committees? Do we have 1? For the totality, when we think about the makeup, we're leaning towards 3 for each rule set. But those are some of the details we're still teasing out in our massive project plan.
And it was great to hear from Jamie that providers are feeling like there's been more engagement and input even as they're being developed before we go to a RAC. So I don't know if you want to share a little bit about high level, some of the work that's been going on. with
Definitely.
Provider input.
And I think it's been great. I've been very committed. I mean, rule writing is not typically like a super strong strength that I have because it's very detailed. But I've been committed to sit on our weekly meetings where we meet all day to really listen to what the input is. We brought on a temporary employee, Reagan Sheely, who was really instrumental in convening I think we did like over almost 20 engagement sessions in about a 2-month period of time, both across the state. I think I shared with that last time, as well as some virtual options, as well as just responding to emails that, have come in. And so some of the changes we made is that in what you'll see in the new proposed rules that I believe will come out is we've added back in the table 3B, because we definitely heard from providers. We heard it today about the fiscal impact and how it runs their programs. And so we've added that back in based on provider input. Screen time, the reduction in screen time we heard was very challenging. And so we came to a middle ground. We increased it slightly, but not all the way back up to what it was, particularly in registered family where there were no standards. Additionally, what was the other one? It was pretty major.
Yeah, that's okay.
But those are
I was reading more of the
examples.
engagement stuff.
Yeah, so we're really taking what was heard in there, and then we're taking it kind of, we started from strengthening and caring for our children as that standard, then taking what we've heard from the field, and then trying to find the right balance based on knowing what would be challenging in the actual practice for providers.
So when you get to setting up racks, when you say 3, you mean by type of care?
Yeah.
After we worked so hard to
That's what
have
we're
a set
trying-
of standards go across type of care, that feels like a step backward, I'll just say. I'm not sitting in your shoes, so I don't know. But I'll just say from my viewpoint, that feels like a step backward if people think only of a certain type of care instead of they share more than they.
Yeah, and I think that's exactly what we're trying to make that decision. Like when you look at who's supposed to be on the rack, that it's supposed to be providers and the end users, for them to be aware of all 3 sets of rules. Like, how do we balance that? Have we done it enough in terms of the staff work and the other work that's gone on for several years? I think that's what we're trying to reconcile. Can we maintain that alignment to align, strengthen, and clarify our rules across all rule sets? Can we accomplish that within 3? I mean, would that be, we're still trying to figure that out. So thank you.
Okay, but the other thing is, one of our principles is that providers are only part of the rack. I mean,
Yeah.
okay.
Absolutely.
because we did have a provider-driven rule system for a long time, and
Absolutely.
that doesn't protect parents.
Yeah.
If I remember correctly, a council member is invited to be on each RAC. Just stay tuned, council members.
Just here, I'm sorry, forgive me, so who else is on the RAC besides the providers and the council members? Are there other membership?
There's state requirements of who's on there. We haven't identified individuals yet. One, we don't know the numbers, but you want to, who's required to be on the
Yeah,
RAC?
so state-wise, it's, those that will be affected by the rules, basically, those who can provide input on what the fiscal impact of the rules would be. So that's sort of a provider group. I think also, and this is testing my studying ability, but I think I heard a council member, and then a family voice, and possibly Hub and R&R as sort of interested parties affected more broadly maybe than providers by the rules, but nonetheless affected.
Most challenging is to get a meaningful parent voice. And we worked really hard and were somewhat successful, always had some parent voice. But that takes a lot of effort because parents are busy and this is detailed, kind of hard to get your head around.
Yep.
So, but I think that's the most critical voice.
I know we've talked about.
This is Eva. I have a question and a comment, or maybe they're both kind of comments.
Go ahead, Eva.
But to the parent role on committees, I mean, we keep coming up against this, and I keep tossing out the idea to various people that have ability to get bills written. But I think what we really need to do is add serving on governmental committees and boards as considered a civic duty equivalent to serving on a jury or, being National Guard, so that employers take it seriously and give the time off to the people to attend meetings like this. Because in my job, it's expected of me to participate in things like this. It's part of my job, so it's easy for me to have time in my work schedule to do these types of things. But for a lot of people that we need to hear from, that isn't the case. And so I think we need to have a shift in our cultural thinking, and whether that's through statute or just somehow getting the word out, that we need more voices at the table. And to do that, we consider this actual civic duty.
I love the idea. I just want to second Eva's suggestion. I think that yes, 100%. I just want to support it.
Yeah, I've tossed it out a few times to various people, and they're like, oh, that's really interesting, including governor's staff. That's not in the room there. But nobody's yet taken a bite at it. So, yeah. I don't know if we could find a legislator to champion that right away. But then my question was around the rules and the implementation of the rules. I heard a little bit yesterday, not a whole lot of detail, but there seems to be issues where providers don't have full access to the rules as they're written right now because they're not posted on the Secretary of State's website, and there hasn't been a new booklet sent out because a lot of them are temporary. And then there also seems to be some confusion about people getting, I don't know if they're, if they're out of compliance or they're just getting, some sort of stern warning about being out of compliance with rules based on the guidelines that have been provided instead of the actual rule. So I'm just wondering, what the timeline for fixing all of those things might be.
Yeah, thank you, Eva. I was actually down at a provider listening session in Roseburg last night and definitely heard those comments as well. And so where we're at with the rule books is they have all been translated, and right now we're waiting for them some final review in some of our languages where we have a challenging in capacity, particularly Vietnamese and Chinese, of getting that review done. And so we're right on the cusp of being able to send out new rule books to all providers in their needed languages of the ones that we support. And so those will be our forthcoming. I actually, in that conversation, if there's some stuff missing from the Secretary of State, that was actually a follow-up that I was going to do today to see because what's on the Secretary of State should be all of the rules as they stand, so that is a place to look. And again, as soon as we have those all final and translated, those will also be posted on the web. But every childcare provider will receive a mailed copy of the rule book because there has been so many changes and moving parts. I think that what we really can hope that people can encourage with providers is that just as it's been confusing for providers somewhat of having which rules are happening now, our licensing specialists are also experiencing that. And so we're doing a lot.
Right, that's the
Yeah, a lot of technical assistance with our staff. We really need to know when that's happening so that we can address it. And I can share with you how we're addressing it internally with our staff is that all of our regional managers actually have a shared staff meeting agenda. So all the same stuff is covered in every region. So we cover it at our monthly childcare meeting that we have with all the staff within the licensing, both from central office to field staff, and then at all of the offices, all those reminders and things that are being heard, there's that shared agenda that every regional manager goes through with the staff. Obviously, if we hear that it's really specific to a certain region, we're providing some extra coaching and clarity for that region. And so that's how we're working to help licensors and providers when there might be some confusion.
Thank you. So if for people that have been like, been written up, sorry, I'm not using the right terms, or, have received some sort of, out of compliance, and it's not something that they actually should have had happen, is there a quick remedy for that so that it doesn't, get posted on the website and have parents concerned about safe sleep or other things that
Yeah,
There's a findings.
Yeah, there's a findings review process, and if they submit for that, and I would say that even if it's, past the time of the 30 days, I mean, we've definitely given some extensions, just given on particular situations past that time, and if upon that review that rule was actually not a rule at that point in time, we would say this isn't, we would find that this wasn't a valid finding because it wasn't an existing rule, and that would remove it from the portal, off their record.
Okay, great. Thank you. Thanks for all that. That's a lot of work, so I appreciate it. And I know that it's rough on both sides to, have a big shift in rules. So thank you.
Okay.
I'll just add real quick, and I'm happy to resend this. You guys adopted sort of a rulemaking model at the end of 2017, and I'm happy to resend it that kind of outlines how the RAC operates, because I know we've talked about holding these meetings in the evening. The nice thing about not having them assigned to a sitting committee is that they can happen 3 times in 1 week. We don't have to do this whole monthly thing, and so it doesn't quite get to Eva's point of trying to encourage families on standing committees and governance boards, but trying to make some of those shifts to make it more accessible to both parents and providers. So I'm happy to resend that if that's useful.
Sure, that would be great, since that was a year ago. All right, thank you, Alyssa. Any other questions of Dawn and Ann? All right. Thanks. So we'll look forward to March and having all of this list become permanent.
Thank you.
So legislative session update. This is going to be an exciting conversation as it has been launched. I think I saw you on TV the other day, Miriam, or my screen, I should say.
I'll start, and then Miriam or Sarah, David, you can jump in and collectively. So Miriam mentioned, do you want to come up?
You want to come up? Who wants to join us up here? Sarah and David?
Head shaking.
Okay. David, I think you need to be up here also. I understand you're a key player in this field now. What a change. Good try, David.
Right. Well, before we dive in, let me just start by
Okay.
saying, just context for David, yeah.
Oh, brother.
Barry Leslie, who is the governor's deputy chief of staff for session, will be operating in the role of early learning policy advisor as well. She has been convening and leading the children's cabinet working group for the governor. And as many of you, as you all know, given Pooja Bhatt's departure as education policy advisor to the governor, her portfolio has been kind of divided up among governor staff. And so we're really lucky and thrilled that Barry is, because in particular, because of her work with the Children's Cabinet, just really, really steeped and well-informed about Raise Up Oregon, the governor's early childhood agenda. And so she will be stepping in that role. As you can imagine, she wears a lot of hats as Deputy Chief of Staff for the governor. And so I'm really excited to announce that David is going to be supporting Barry in the early learning policy advisor role during session. And so that is going to mean he's really going to be a lot more kind of embedded and sort of working with governor's office staff and Barry around the role that they play in advancing the governor's agenda. But also still, thankfully for all of us working on the ELD side in session, still, being available to us as well. I started a hashtag Monday afternoon that said, "Thank God David stayed," one of my emails. Obviously, his experience, the vast experience he's accumulated over sessions is really sort of important to us as I've also been referring to myself as a rookie. So to really be, I think, lending the support on both. So it's going to be, I think a lot of work, and very grateful for David and excited for being willing to do this, and really excited to be able to work closely with Barry during the session and for Raise Up Oregon. So David, I don't know anything else you want to say about your role?
Absolutely nothing else.
Okay. So his experience and capacity will be shared and available to both Barry and us. And so anyway, I wanted to just mention that, and then we can sort of dive in, but.
Yes.
So as Miriam mentioned, we've already presented before the House Education Committee yesterday, and they've asked us back, along with Sue for the council and some hubs, to present on Monday to give a little bit deeper overview of the division, Early Learning Council, and sort of all the work happening. So excited about that. So this sheet you have, a packet you have in your binder, is all of the bills that we've sort of deemed highest priority or most relevant to our work. And we've indicated.
Based on what's been submitted.
Based on what's been submitted. So we do know there's more bills coming, and so we'll update this list for you guys monthly. If there's major shifts, we may send you some email updates in between meetings as well. And so I won't read off every bill number, but we have noted where appropriate which of these bills have been submitted by the governor as well as the Chief Education Office, just to get a sense of where some of these bills are coming from. We do have a couple of bill hearings we already know about. So House Bill 2025, which helps expand preschool, as well as House Bill 2261 and 2262 all have hearings next week. 2025 and 2262 will both be with House Ed on Monday after we give our overview presentation. And then House Bill 2261 will be going to the Joint Student Success Committee on Wednesday of next week. So we're ramping up quickly, and we are thankful that David stayed. But yeah, so we'll continue to update this, and if you guys do want more frequent updates via email or some other way, we're happy to facilitate that. Are there questions or anything you guys want to add?
I think just a couple.
I would. Sorry, I thought you were asking us if we had questions or comments.
Oh, sure. I just wanted to give a little bit more information to Khalid. We have, Alyssa referenced, we had a presentation, and Sue yesterday, House Education. As you look at both the bills that are referred to ELD, we have a couple of different committees, we think, or that will be considering a number of these. So we've got House Education, which we have the opportunity, the education agencies to sort of introduce them, because there's new members. We know that child care bills, the Health and Human Services Committee in the House will be considering those. And then there is the Student Success Joint Committee, which now has an early childhood subcommittee, which a number of these bills will go through as well. So just as you're hearing, we no longer have the House Early Childhood and Family Supports Committee, which acted like kind of the central coordinating committee for all of these policy bills. So the tracking and looking at these bills is looking across multiple other committees. So again, the rookie's talking. So Alyssa, David, anything I got wrong there or anything? But sorry, Kali, I wanted you to have that context.
Okay, well,
Kali, hold on. Hold on one sec. David's going to make one other comment, and then we'll go to you.
Just wanted to note, as Miriam mentioned, we were sad to see House Early Child and Family Support go away with Chair Lively's leadership, but we're also really excited that he is going to be co-chairing the Joint Student Success Education Early Childhood Subcommittee along with Senator Frederick. So he will still be there to be a champion leader.
Yes, that was great news. Yeah.
Yep. Thank you, David. All right, Kali, comment or question, whatever.
I had both. So I had heard about the subcommittee the Chair Lively is going to be part of, and I guess I was curious of how it's going to function. And since they don't have like the committee like they had last year, is it going to serve a similar role? Because I was just told that it existed, but it wasn't clear to me what the role of the subcommittee was in comparison to what the Early Childhood Committee was last year. And so I don't know if you could bring more clarity around that. And then my comment was just, I think email updates to some degree would be helpful because I know things are moving quickly, and there's a few different groups from community that are advocating on behalf of some of these bills, and so I just think information updates would be helpful.
Right.
So, because that question was asked. So that's my comment, and then the question about the subcommittee.
Yeah, thanks, Kali. Great question. I'll start, and then my colleagues, please jump in. But we are meeting with Representative Lively today. So I think we'll have more information around kind of the priorities and sort of vision for the committee. So just to note first that we're still getting information as well as this is all new, and there's new members and sort of new chairs. So there have been some shifts, but I think what I feel like what we do understand, again, we'll confirm some of this with Representative Lively, is that the policy bills, so that to your point about House Early Childhood Family Support really being able to coordinate around different kind of programs and legislation affecting kind of different programs across early childhood does seem to be part of the role that they'll play. Just also want to point out as well that Joint Student Success was really kind of organized around revenue. So there will be, we think, also a role that they're playing around budget as well. So, David, anything?
Okay.
I think the only thing I would add is the structure with the Joint Student Success Committee is really unique and really different than any other session. So I think there's also just everyone figuring out what joint student success means for the session, let alone what the subcommittee means.
Mm-hmm. Yep.
So, Mike, can I ask a follow-up question? Because the Joint Student Success Committee, my understanding, has had there was that subgroup that went around the state that I feel like is connected with the Joint Student Success Committee, and they were focused solely on K-12. And so I guess part of me is wondering, is the idea of the subcommittee to inform the focus to extend beyond K-12, even in sort of these revenue scenarios that they're talking about? How much is early childhood a part of it? Will the subcommittee be providing any input to the conversation that has been, and the governor's budget that has been fairly K-12 focused.
Sarah, you want to respond?
Sure, yeah. So this is Sarah Cully. So I think in that tour around the state that you referenced, what the subcommittee heard, or what the committee heard a lot of, is the need for early learning. And so their recommendations did focus on early childhood in addition to K-12 during that summer session, which I think pointed to them needing this subcommittee as well. And so it is a full continuum that they're looking at across the education system. Including early learning. And so they will definitely be a part of one conversation. The revenue conversation is about early childhood through the full education system.
I think we could share, if folks have not seen the recommendations that came out of the Joint Student Success Committee, the Student Success Committee, we could share that, so you could see.
They're convening today, and as part of that convening, I believe they'll be releasing a sort of set of recommendations to kick this off from the 4 co-chairs of the joint subcommittee, so we can also make sure you all see that when I'm not sure if it's.
Yeah, that's probably
yet, but
better
it's
to just
coming
look
out
for that,
today, so we can do that.
But again, I think we're just really excited about the committee, and again, Chair Lively, because as leadership, because I think it then does become the place where we can have more comprehensive conversations that are considering childcare, EI, ECSC funding, preschool funding, baby promise, kind of within one committee. So.
Okay, well, that relates to my question. It seems like our bills are going to multiple committees. Education, Human Services on the House side, as well as this new subcommittee, and then other things on this. Anyway, so if the bills are moving through committees like House Education, how does that relate to what the subcommittee? Where will there be a big picture? It feels like the last session, we had one place where the conversation, where you could educate people and it paid off because they were looking at a broad set. Now it feels like we're back to going lots of places. Am I misunderstanding what's happening, Sarah?
So all of the agency bills, at least that have been referred so far, receive a first sort of referral to those 2 committees, but have each received a subsequent referral to the Joint Student Success Committee. So they will all sort of coalesce there.
They'll start? I just want to be sure I'm understanding.
Yes, our
They'll
agency
start-
bills are all House bills, and so they'll start, if they're related to childcare, is the pattern, I guess, we've seen and anticipate in the Human Services Committee or in the Education Committee, and then receive a subsequent referral to the Joint Student Success Committee.
So they're all going to have 2 hearings, one either in.
I think there's still a fair amount to be determined, and so I think that seems to be the case for education-related bills that also would require revenue to support what's in the content of the bill. So that wouldn't necessarily be true of a pure policy bill without a fiscal impact. So I think there's a lot to still figure out. So, but I think what it does mean is there is a lot to track this session. Things are going to be moving quickly, and it's going to require a fair amount of everyone being very nimble.
Because there's also a Ways and Means Education Subcommittee historically that's been sitting.
Yeah.
So I think as David said, it's a much bigger landscape, and we're going to be needing to do a lot of work with a lot of different committees and legislators to sort of track and, respond to information requests and hearings and testimonies, so.
Hence, loaning David for the next 5 months. Wow. Okay, other questions about the process, which obviously is still evolving, or any of the bills listed on the information that was handed out to the council? Any bills you all want to highlight?
The only thing I would say is we're tracking a number of, not all the ones that you've listed, but tracking a number
Yeah.
of the ones. So we're tracking 24, 20, 27, 23, 46, 43, 48, and 183, SB 183. So we're tracking a number of them because it does have a direct impact on us or some related impact on us. So we're just working on it. And I know that we're actually just connecting Cynthia, our ledge folks, with kind of a list that I make sure that we're at least getting a little bit more cohesive in our messaging, especially as we're hearing about these multiple committees and that are going, how we're able to have at least somewhat of a aligned, consistent, or coordinated voice.
And I think thanks for bringing that up, Bill, because that's one of the things I wanted to make sure we talked about today as a council, is that this is, this is a list that's really talking about bills that have an impact or reference to sort of the early learning division, but this isn't the comprehensive list of, when we think about legislation that, is aligned with Raise Up Oregon or sort of representative of all the, like UK, CARA. So I think we would love to be able to build out this list with the other bills that you're tracking that you think really have an impact on sort of our vision at work. Or I don't know if that's, or maybe that's something Alyssa can do with your ledge coordinators. And it doesn't have to be, but comprehensively. But if there are things that you think really are aligned to this sort of vision and the plan.
We're tracking most of these, like Bill is.
Yeah.
We're actually tracking over 60 bills right now. I don't think you really want our whole list.
We are tracking over 60.
We don't want your whole list. We want
I'm not giving our list.
what impacts Raise Up Oregon that
Sure.
you would prioritize that isn't here, that we should know about, I think.
I know. It's a busy set.
I mean, we just want to make, what's happening kind of with home visiting, TANF, things that, you think are important for us so that the council can stay informed more broadly than what ELD will be looking at.
Well, and where there's overlap, and I'm sure there is a lot of it on these bills, as you're pointing out, Bill, it may provide an opportunity to do some co-presenting in some of these committees, so they actually say, oh, you guys really are talking to each other, and there is cross-sector work here to focus on young children and their families. So it's probably the ledge directors who are going to have to do a lot of that sort of strategizing, but it sure would be great if we could find some really tangible ways to impress upon the legislators that there's a whole system that is developing.
Yes, we did suggest we add to the Universal Home Visiting Bill, SB 526 is another one that just
Hearing on
dropped.
Monday.
Yes, hearing on Monday. So we'll aim for weekly updates to you guys via email, recognizing there will be changes throughout the day. And then if you ever have questions or hear anything, you can call me directly, or David or Sarah, any of us, and we'll get you, the most up-to-the-minute information we have, if it's not in the weekly update.
What committee is that in front of, Kate?
House, Health, Senate, it's Senate
yeah.
Health. Senate Health.
And I would just.
Dennis Anderson, our friend.
I would just say that last session, we weren't really asked to advocate strongly, and I am willing to do that, to reach out to local legislators for advocacy and know that we can do that in a way that employees of the state cannot, so. Some of us can, so.
Excellent point. Excellent point, Terry, thank you. Any other questions about the legislative update?
Good luck. It's a full session. Start sleeping now, packing your snacks in your car.
Too late. Had to happen over the holidays.
Yes.
All right, hope you're
Great.
rested up.
All right.
Wow, okay. Strategic plan rollout, next steps. Thank you, David and Sarah. And
Okay. So, and this, Khalid, if you have questions, let me know. This gets to your earlier question. So, We, as you all know, have a legislative breakfast that we're scheduling, but we are working on a press release for Raise Up Oregon to go out this week. We have made sure that all of the hubs have copies of the full plan, the executive summary. But what we're also trying to do is we're getting a web page ready to launch, as well as working on creating some PowerPoints, materials to help guide dissemination and, slide decks in case you guys want to present to your hub governance boards or any groups that you're affiliated with. So that's something that's in the works that we're hoping to accomplish over the next several weeks. Another thing we're working on to build off of that cross-sector alignment is still working to sit down with all the agency heads to make sure that we know we've already captured the work that's in current and existing plans, but making sure we are building off of that grid exercise you guys helped us with in October to really capture who wants to take some leadership roles in helping to implement the strategic plan. And then we're also working on what needs to happen internally, both with the division as well as all of our agency partners to make sure there's that internal tracking and coordination. And then that will help inform what work groups need to be convened, which agencies will be taking the lead and reporting back, and some of those more in the weeds nuances. But the hope is that, reporting will come back to the council as the convener and coordinator for this plan. We also are planning on doing an annual report that would be in alignment with the dashboard, but really to give you all a sense every year about where we are with implementation, feedback on if some strategies need to be adjusted or if there's partners that are missing. And so really just making sure that we're kind of keeping that continuous discussion happening and not just saying the plan is done, but it can adjust and it can be nimble as we engage with more partners and engage with our agency partners to really work on implementation. So the next couple of months, we're hoping to get that grid finalized and back to you guys, make sure that the council has appropriate leadership assigned where necessary, and then also working on those dissemination supports to all of you to share with your partners as well. But are there questions or are there things that would be useful now that the plan is out there in helping to spread the word or talk more about this?
I'm very interested in the slide deck.
Great, good, okay.
That would be very helpful.
Okay.
You don't want me to go off script.
You think a slide deck will?
A slide deck will help me
Yes,
try to stay in line.
would help all of us.
Yeah, great, that's good feedback.
Alyssa, when I was at the Northwest Hub governance meeting a couple of weeks ago, the 3 or 4 page matrix we have with the circles, half circles, et cetera, it was a very good tool to have the agency partners review it and say, oh, interesting, that at least, the state level agency is saying that's a circle or not. So, and we talked with them also about having the partners take the plans back to their own agencies and make sure that internally that their colleagues and coworkers know what's in the strategic plan, because they're going to obviously be a key part to implementing it. So I think anything we can do to encourage partners to do that.
Great.
And also I had the sense from the feedback and conversation at that meeting that, what may be a full circle for a state level agency at a regional level or even down at a community level may not be such a full circle. So I think it's, and we know there's got to be flexibility built into this. But I really encourage us to get that out there as a tool, because it builds that cross-sector conversation in a very concrete way that is a little harder to get at when you're going through 35 strategies in a plan.
Yeah.
Great feedback, Sue. Yep.
Thank you, Sue. And the version we have right now shows where it sort of aligns with the icons, so it's where our agency partners had planned work. And then we've noted sort of in gray where we think they'll play a leadership or sort of supporting role, but we are working on getting the agency directors to approve that, and then bring those back to you all. I think that's a great point, though, Sue. I know we have a column for the hubs, but then breaking down what that actually means for the hubs and what this means for our agency partners at a local level, obviously won't necessarily match up with the state grids. That's a great point in how we think about sharing this and supporting our local partners as well.
And I just do want to emphasize, Kali's question at the start of the meeting and what Alyssa said about how important it is for us to be intentional around dissemination and sort of putting that plan together and really taking the time to do this, not just jumping over that. We know that some of the strategies in the plan, like I mentioned during the PDG update, the grant is resourcing and will move. So I don't want us to, in a way, session and a lot of these bills that we talked about is beginning to implement Raise Up Oregon. Things are happening. Some of the things that are in the plan are, because of the alignment, are things that agencies had planned to do. That's what they told us, and so they're working on them. So there is movement, and so work is happening, I think, and we need to make sure that's all coming back to the council. We're using our council meetings to share that, but going back to Kali's question and Alyssa's comment about dissemination, how many times have we been part of these sort of strategic planning efforts where you get all this input and then you don't go back and say, here's what we did with it. And this is like what's happening and what is the next step. And we can't jump over that, I think, as a part of this effort, because we did put so much into feedback and engagement and getting stakeholder input and community input. So all of us, all of you, working through, your agencies down to your regional partners, really supporting the hub, supporting council members, going back to a lot of those stakeholders and now saying, here's the plan. And kind of what you did, so getting that feedback of like transit, what does that mean for them now? And is stuff that we want to be really intentional and focused about, I think, and just know that there is stuff that's happening in terms of some of these strategies really are moving, and but let's really take this time and think about dissemination with some intention.
Right, and it was one other comment, and then Bobby. There was interesting conversation around the table among the partners of sort of an increased awareness of, I didn't know you were doing that in X community, because that one covers 3 counties.
Mm-hmm.
So there are a lot of different ways it plays out depending on the county, which is true for every region, I know. So building that awareness in among the hub leaders was another benefit of going through that matrix. Bobby.
So I'm less clear on our hope for how much regular Oregonians are going to know this plan or think it has anything to do with them. So we're going to do the 5th with the legislators, and I assume we're going to want to connect with the ones who don't make it to breakfast. And so that, but then how about, and you said you were doing a press release, do we have any ideas on what's going to hook Oregonians who care about children and families, that something is happening?
Yep. Well, I think we will. I think that's part of it, is really as being able to work with our hubs and our partners who are sort of closer to the, to directly interacting and serving and services to children and families. And hearing from them about what kind of some of those strategies are, what those opportunities are. And so I think that's a big part of dissemination, and in really bringing some intention into the plan. So I feel like that's when I'm saying, let's take some time and really build out a dissemination strategy, figure out what tools, what are the effective ways to reach it. But I think we need more feedback from people that are closer to the, children and families day in and day out and providing the services than we are as directly from where we're sitting here, at least speaking for the state agency of ELD.
And I heard too, that you guys haven't received the executive summary, so I'll send that to you. Because the goal of that is to be a little bit easier to read and more, I mean, obviously less comprehensive, but easier to kind of follow and a little punchier. So, again, we'll have some additional supports, but I'll make sure you all have that document as well, which will hopefully aid in helping get more buy-in at the community level. Yeah.
Well, I'm hoping that Melanie's gonna.
Oh, well, of
Yeah.
course,
do this for
absolutely,
us,
yeah.
so- But we figure she's
Right, but
been
yeah.
here 2 days now, so.
Yeah, I mean, for sure, but I think in terms of putting the dissemination plan together, figuring out what kind of tools or materials, right, are gonna help us talk to like a lot of different kind of audiences. And I think building and the ability of having the hubs help us get some input into dissemination, I think will be really useful.
Well, and I think also to your point, Bobby, I think we may have shared at an earlier council meeting, when Miriam presented information at the Children's Cabinet meeting that, the governor chairs and convenes, there was quite a long conversation about how do we get communities all over the state, people, citizens, to realize that they have a role to play in raising the children in their communities.
Yes.
And it isn't going to be a bunch of state agencies that are going to make that happen. And so there's quite a conversation about how can we the cabinet leaders, sort of begin or launch that conversation. And what's a strategy, a communication strategy for the state of Oregon, so that citizens really buy into the idea that they're responsible for the
Right,
children.
that's what I was trying to get at.
Exactly.
Churches,
Yeah.
Exactly.
Right,
It's
civic
not
groups,
the plan.
Yes,
chambers
not
of
a-
commerce, is there any
Right.
thought that we could really get them to pay attention?
Right.
And it'll take all the advocates who are going to be very focused on the session. I think post-session, maybe I'm hoping there will have been enough momentum built around early learning that maybe we can just roll right into that bigger conversation, not about bills, but about the sense in the state of Oregon about who's raising up Oregon. So, anyway, just so you know, other people are asking the same
Okay,
question
good.
and nobody has answered it.
Okay.
All right. But at least it's being talked about. Anything else on next steps, Alyssa or Miriam?
We'll see if we have that revised grid ready in February. Otherwise, our hope is definitely March we'll have that. And obviously, that will help inform sort of the priorities for this year. So we're working on getting that as quickly as possible.
Right.
Chair Miller, can I get into the queue, please?
Yes, Martha, you are up.
Okay, perfect. So in this strategic plan conversation that we've just had, I've heard how we're going to disseminate information out to the communities, how we're getting buy-in from or support from the agencies, and that we're working with hubs. Can someone explain where the role of the early learning council members are, as well as how we're reconfiguring committees to also augment and support the strategic plan?
So I can start. Martha, I'm not sure if you were on yet, but we will be looking at different resources for council members to be able to talk about the plan. So that would be, eager to hear what ideas, what you think would be useful to you, standard, sort of PowerPoint template, things that you can leverage your opportunities that you have as a council members to educate and kind of inform and disseminate about, about the plan and assist with dissemination. I think we should, what I would propose is that we have ELC exec begin working on a proposal around then how to be able to both, integrate and start to think about in the future as we really are develop, thinking about where we would situate some of the strategies. So Alyssa said we still need to get the grid finalized. session is a form of implementation. So things are happening, right, in terms of working on the plan, but really the council role and committees, I think I would propose we start to work with ELC exec and then bring something more comprehensive to the full council to discuss, right, about where the council in its sort of coordinating and convening capacity, right, will be able to, the key areas where that will really help to drive implementation, or committees will, on some of the strategies. Anything to add to that, Alyssa?
I think the other area too is just, the grid will be a tool, but we'll also make sure we get the council's input there in terms of what the council role needs to be. And I foresee that being a potentially robust discussion too. So it's not just approving what the agency directors have suggested, but making sure we've really carved out the right role for the council in that, alongside with a proposal for what committees look like and how the council really owns implementation. Yeah.
Okay, thank you. Yeah, it's not so much presentation, it's the implementation piece that I'm asking.
Yeah.
Thank you.
Thank you, Martha. Any other comments or questions from council members on the phone?
Or anything about legislative breakfast, do you want to remind folks about?
So we have a private legislative breakfast on Tuesday, February 5th at the State Library that begins at 8. Due to capacity, we can't open it to everybody, but if you have questions, let me know. If there are any legislators that you feel like you have a particularly close relationship with, we're trying to hit them at all sides, so feel free to reach out and encourage them to attend. Feel free to email me if you need additional information around that. We're hoping to have the agenda finalized early next week at the latest, so we'll follow up with that once it's finished.
So
And
you said
our
it was
role-
closed, but you want all of us, you want us there?
Yes, as council members, if you can attend, that would be great, yeah.
And our role, other than trying to get key legislators there, is?
Yeah, so it's a pretty tight agenda, but, hoping to, we'll obviously be talking about the strategic plan and its cross-sector nature. And so really just being there to kind of mingle with the legislators, we'll have some funders there as well, but just kind of to reiterate what the comprehensive process this was. And again, to your point, Bobby, how this needs to be owned at community levels, and legislators are one of the levers we have to make that happen. So this will sort of be the launching of it, but obviously there's a lot more work and more discussions that'll need to happen after. So this is just the first piece of that puzzle. Yeah.
Okay. Anything else? Questions, comments? Good. If not, let's see, to just remind council, our next meeting is
virtual.
February something, 20-something, I'll bet. And we decided earlier we would alternate in person and then virtual meetings.
It's the 28th, February 28th. So it'll still be 11 to 1, and I'll get virtual information out to all of you.
Okay, and it'll be, yes, just a call-in or web.
Yep, a Zoom meeting. So if you can participate via webcam, that always makes it easier for discussion. But yeah, we'll send all that out.
Okay, and then fortunately, we'll be back in person in March.
Yes.
Because that's when we'll be adopting rules.
Yes.
Which will be helpful. Okay.
One question.
Yes.
So with the virtual system, how does that work for testimony if people sign up for testimony? Is that
So-
just contact you still, or how does?
So we'll be streaming it. For our virtual meetings, we'll accept written testimony, but we'll only be accepting verbal testimony during the in-person meetings. Yeah, in alignment with the Attorney General. Yeah. Yeah.
All right. Thank you. We are
Thank you.
adjourned.
Great, thanks.
Great meeting. Thanks, staff, for great work and council.
Thank you, everyone, for hanging in there.